Well, you know, we're always better together. In today's Better Together segment, we're taking a minute to acknowledge Men's Health Month. We want to welcome in Dr. Gerald Hauptman, the Chief Medical Officer of Population Health at United Healthcare. Thank you so much for being here with me. We were just sitting over here chatting. When it comes to men's health, I feel like we don't talk about it as much, Doc.
No, we don't. And as in our little chat ahead of time, you point out the real reason. Guys do not like to do this. I will give you a little fact.
Okay.
Right? And I probably shouldn't use this word in this context on TV, but what the heck? So we did a poll. 73% of men would rather clean their toilet than come visit their doctor. Now, granted, they said clean a bathroom, but you know what's in the bathroom.
Right.
It means they'd rather do that than come see us. And I'm sorry, I don't care who you are. That's got to sting a bit.
No, right?
Yeah.
Why is that? Why do you think that there is this sense of not wanting to go to the doctor, or maybe even talk about wanting to go to the doctor for many men?
For the most part, I think for whatever reasons, especially when they're younger, this seems to transition somewhat in the mid-50s. Men do not like to be poked and prodded. They don't, I think in many ways they're more concerned about bad news than women are, and they don't like to hear it. We just looked at our data for the last 2 years, for example, and millennial men, almost 10%, we have no claim for them in the system whatsoever. They haven't seen a doc, they haven't gotten a prescription, they haven't done anything.
Really? That's shocking to me, because I feel like we have so much access. It's so accessible, especially with a lot of the telehealth things like that. I mean, that's wild. What are some of the other trends that you've seen?
In general, we see that men delay health care that they get in their mid-50s. They don't get their preventative care. And if you don't mind, let's delve into what they should be doing in terms of their preventative care. Now, the way we usually think about this, I'm sure if you've had other guests, they talk about, well, you know, you need to get your cancer screenings, you need to get this. Got it. Well, think about this. Most men under the age of 45, there's really no cancer screenings, no prevention. So they go, well, why should I go, right? I'm going to give you 3 good reasons why you should go. Number 1 reason, because nothing's wrong with you. That's the goal, to go there and find out nothing's wrong with you. And if you get a run of 45 years with nothing wrong with you, you've had a good day, all right? Number 2, find things when they're small, before it becomes a big problem. You know how you have that stroke later? Because you had high blood pressure you didn't know you had for 15, 20 years. Pick that up when you're 35, pick that up when you're 40. Your blood sugar's a little high. And then there's the third one, when something really is the matter and you didn't know. So when I was millennial age, I went for my annual because my wife made me. She's a nurse. She made me. I wouldn't have done it. I'm a typical guy. So she made me go. And I was an endurance athlete in high school, and I ran competitively in college and ran competitively afterwards, and so I was still in good shape at that point. And I was telling my doc, I got a pain right here in my shoulder. Is anything wrong? Yeah, I got this pain. And I said, you know, if I move my shoulder the right way, I can feel, I think, a mass. And he checked it out. He goes, I'm not sure I feel anything, but we'll check it out for you. We'll get an ultrasound. Well, to make a long story short, about 13 days later, I was starting chemotherapy.
Wow.
And so those are 3 excellent reasons. Just show up, do your preventative maintenance, and head on home.
Thank you for making us a little smarter today. And of course, we have much more information about Men's Health Month at KARE11.com. We'll be right back.